Hello, welcome back to yet another episode of Heartbeats and Hope. Once again, this is Dr. Masike Mugela. I am so happy to have you again. Thank you for liking, for subscribing, for sharing, for overwhelming me with love. I love you guys. Thank you so much. So I am very excited today for yet another episode. For those of you who watched our previous episode, we talked about career versus calling. And for those of you who have not watched it, what are you waiting for? First, go back and watch. Yes, so in that episode, we talked about where you find your calling in your career and the fact that in most of the times, your primary calling actually has a lot to do with your career path that somehow you found yourself in. And because of that, because I believe I am one person who has really found my calling a lot in my career, which is medicine, today I'm very excited to have a conversation with you that I have wanted to have for a very long time. I believe that it is going to be life-changing, life-transforming for you, for me, for everyone. And it's something that a lot touches my heart, and I believe we need to discuss it. You and I need to have this conversation. So today we are going to talk about the Google patient. So in the corridors of the hospital, we call people who over-search for their symptoms before they come to the hospital, and then they come with preconceived ideologies or ideas or diagnosis or whatever you want to call it, Google patients, because clearly your doctor is Mr. Google. And it is something that is a bit interesting for if you ask people in the medical world. However, today I am not alone. I am very privileged to have a colleague with me, and I would like to introduce you to Dr. Timothy Byarhanga.
Hello everyone, like she said, I'm Byarhanga Timothy, doctor as well, and also pursuing physiology. Dr. Masi, I'm so humbled to be here. We've been watching the whole build up for the episodes, and we are following, we are liking, we are subscribing, and I'm happy to talk about the Google patient with you today.
Thank you so much. So Dr. Timothy, are we being fair by calling Google patients? Or what do you understand? Maybe I just know it from the corridors I've gone through. What do you understand by a Google patient? And are we fair?
I think the term coming from literally a patient Googling their symptoms, that's why they've been called a Google patient. I understand why it's easy to coin, it's addictive, it's easy to talk about it. So you've been Googling your patient, so your symptoms, so you're a Google patient. But I do not know probably how it makes them feel being called a Google patient. I think in a way it stereotypes them, and I think no one is happy about the stereotype. However, today we shall talk more about it and try and see how to alleviate the harm that has been caused by the term.
Thank you. I think, as you talked, I felt that perhaps the Google patient watching thinks they are talking about someone else.
Yes.
Thinks, by all those people are evil. How do they do that? Yes. Aren't you the one we are talking about? So, we are having this conversation, and perhaps I don't want you to think we are taking this from a foreign perspective. I personally believe I have once or twice been a Google patient, but also I interact with a Google patient every single day. Almost every single day. So, and from my personal experience, feeling something and then you want to see what Google thinks. You have a headache after a long day, and you put headache after a long day, and then now being a medic, I can sometimes see that well, Google, you're overestimating this. This can't be it. However, in those moments when the devil has visited you, even me as a doctor, I start to be like, it could be. So when I see, okay, now I'm no longer a Google patient, I got born again, received Jesus Christ as my Lord and Savior. These
Amen.
days, I try as much as I can to desist from looking there. But having been there before and having seen what it can do to me, who not only is relying on Google, but also has experience medically, I can sieve through and say this is true, this is not true. That is one of the reasons we are here. So before we again serve the food, Dr. Timothy, what has been your experience with Google patients? And perhaps both positive and negative.
Let me
If
start
there
with,
is a positive.
I think I would like to start with a positive because they are so few. Because you can imagine probably if you're a patient, probably put yourself in a doctor's shoe. I know it's hard for patients because you are sick. You don't want to feel how the doctor is feeling. You want your issue to be done. But you can imagine the Google patients. I would say that I upload the curiosity. I think probably that health-seeking behavior is also very important in management of a patient. Because if a patient is not minding about a pain, that means they won't get the treatment and they will worsen because pain is physiologically important. Now that's the advantage I have. The disadvantage is it's all blown out of proportion. In that, and they come at weird times. Usually the Google patients don't come in the time like during the day. They come probably at night. My baby has been sneezing. Is it a sign of TB or something? Or tuberculosis? TB is tuberculosis. So and it's at night, your night shift is, you've been probably working and you have rounds to do and you have to make sure you're following up on treatment. And they come those weird times, it's been sneezing. Then you're like, did you wake him up or something? I woke him up, I brought him here, and you see the baby's already sleeping. And you're like, you get it. So really, even as we associate that term with negative emotions. I remember one of them came and we had a long line on OPD, outpatient department. It's a long line of patients and it's pediatric. So, you have to work, kids are crying, you're telling everyone you want to check your mouth and what, and your ears and nose and everything. Then the mother comes with the baby, probably like 3 children, and her baby. And the baby is there, hey, I'm a doctor, I think my son needs an operation. Operation? This must be a serious issue. The mother exposes the baby, and you see just some small bump on the umbilical stump. You're like, this is the problem, don't you see it there? It's a mass, we need to go and remove it. And I'm like, you get it. So I was wondering, how do we even start to consider such a thing? And of course we have to reassure the patient that the mother that this child will be okay, give it time it will seal and everything will be okay. But the fact that she had jumped everything and she's not asking for your opinion, she's saying, doctor, you are standing in the way of my operation with my child. So that this mask goes away. It's a bit drastic, it's a drastic measure, and that is why we associate it with the negative or disadvantages of being a good patient, in that you're always prone to blowing it out of proportion and saying, the worst. You get it? It's the worst. You get it? My child is not breathing. My child is breathing. They are asleep. They come in the middle of the night because of, that anxiety. And I think it also happens in, some of these middle class.
Yes.
Yeah, middle class. They have some
ones.
They have not been around the whole day.
Yes.
During that day, and they have come now, the child is sneezing. And I'm like, my child cannot sneeze. I've been working the whole day. I need to take this child to the hospital, and yet the child is really okay.
When I was young, my parents didn't have money to take me to hospital.
Yes, surely. They would only take you if it's very serious. But now a small car rash, this can be leprosy. So it's really blown out of proportion.
Yes, and thank you so much, Dr. Timothy. And I know that there is a very thin balance between you being negligent and you blowing things out of proportion. So we are not in any way saying that if your child sneezes, you don't need to go to the hospital. We are just saying that you will go to Google and Google will tell you that this could be a sign of TB. And then what could have waited for morning, you will rush in the middle of the night because you think my child has TB. As a matter of fact, even if they did, perhaps there is not much that will be done there and then. So I have seen so many. I think recently a woman walks into my clinic room and then tells me that they have been feeling pain. Not even pain, a sore throat. I mean, through the COVID season, we had a lot of sore throats. I believe most of us do understand. They are uncomfortable when swallowing, and they want me to check for what could be causing it, but most importantly, cancer of the throat.
First and
I
foremost.
said, cancer of the throat. Meanwhile, she also had a flu.
Mm.
So I'm here telling her, now you see, these viral infections sometimes can cause a sore throat.
True.
Yeah, but you know how a patient is not satisfied. Doctor, can we do a scan? Like, yeah, even if we did a scan, it's really not going to tell you what you want here. It won't show anything. Then you know, the other thing about Google patients is most of the time they come with their minds made up.
Yes, they
and they don't even want you to say anything. So now, from a doctor's perspective, if I'm trying to tell you and you're not even for a moment trying to give what I'm saying a benefit of doubt, it becomes so hard. So I'm telling this person 3-day history of pain while swallowing or discomfort in your throat may not really be cancer, and it could be eventually, but the way we learn how to treat you is we start with the commonest, and we say common things occur commonly. So what is the commonest thing that could occur or that could be causing a sore throat? Maybe it's a flu. Maybe you have
flu.
Yes, or
Allergy.
gastroesophageal reflux. It's acid moving up.
True.
And it's 3 days. So before we jump to, this is throat cancer, usually any doctor will take it step by step. Now I'm trying to tell this lady, it may not be. So how about we first treat the flu? Doctor, but I have been doing some reading. We upload, all of you do some reading, and usually when we said, Doctor, I've been doing some reading, we really know where the reading was, because when it is some very logical reading, you may not come with that kind of conclusion so fast, but because you went to Google and said, throat pain, So when she said that, I was like, this is an informed thought. So now I tell her, now, you see, have you lost weight? I go through the symptoms of maybe this could be, do you feel it, do you find it hard to swallow? No, I don't find it hard, but it's uncomfortable, doctor. Okay, so how about we treat the flu? Okay, yes, but is there a way we can check and be sure? Then I tell her, no, okay, the way we can check is really through an endoscopy. Now an endoscopy is this much and this is what we do. Then when I told her what we do, she's like,
I think some of the watchers don't even know that in Uganda, most of those procedures come out of pocket.
Yes.
I think out there it's insurance, and
you just go in and
you tell someone the actual price, and they can sometimes change their mind and the diagnosis that they have.
This one changed their mind. They're like, I said yes. I have to go to theater. I said yes.
And we have to prepare it.
And we have to prepare for theater.
Yes.
So then I told her, if I thought that this required that, I would really cancel you into it. Sure. But if we treat the flu and this symptom persists, let's come back and do it.
And by the way, even on that point, I think another disadvantage is they get angry when you tell them, but this is not what I've found.
Yes.
They are like angry, so I wasted my time. I wasted my time researching, I wasted my time seeing images. This is the same image that my version has, and they show you where they've read from. They sometimes even quote for you this paper, so and so. And it's really amazing. Sometimes, as doctors, usually we have some post-evaluation, like you first think about what you've gone through and the different responses from patients.
Yeah.
It's really amazing, but don't get angry if your doctor has told you it's not likely to be this. Yes, doctors are not perfect, but we've spent time trying to craft our skill and to pick out what needs to be picked out so that you can get the best treatment.
I think there is a meme that was going around some time back, perhaps in the doctor's circle. But it's those things that, by the time a meme becomes relevant to a certain group of people, it means it's speaking to something. So by the time it's now everyone is sending it to another, it's because there are times when you want to tell this person that yes, this is, and some of them show you, doctor, this is it.
This is it.
And you're like, yes, I know English, this is what it is saying. But Google is a collection of so much information and you have to sieve through. I think there is a man who came with a pregnant woman and they came for a cesarean section. First time mother, everything is okay. But why? Because they did an ultrasound scan and they showed a loose cord around the child's neck, and they know that they read on Google this can cause the death of your child. So they come and they're like, cesarean section. And we do the exam, everything is okay, woman is in labor, the cervix is opening well, it's a first time mother, and the baby is okay. So we are like, you know what, yes, what you're saying had some water, but that's why we monitor labor.
Sure.
So how about we actually pay close attention? Should the baby start showing signs of danger, we are going to operate. The man didn't want to know, this is my child. Let me tell you, I've taken care of my wife. So, I remember I was the one who received them, then I called the guy on duty because sometimes you need someone to cover you. You're like, I can't handle here, maybe I'm wrong. And for those of you who are junior doctors, really it's something you must learn. You must learn to be confident in your decision, and if you have any question, instead of falling for what they are saying, seek superior opinion. But a Google patient can make you question your school. So I called in the guy, and the guy did the examination, and then somehow the man was not willing. The good thing is that the wife was like quiet the whole time. So after that, but the woman looks like she wants to try. This is my wife now. What? Quotes the law. What? The child is mine. I'm like, then after we're like, you know what? This is our patient. The woman is our patient. If the woman wants to go ahead with a cesarean section, we will do it. If she has any doubts, then she's sober. Let her make the decision.
Sure.
Then somehow, eventually, she asked that we give her some time to try. And she gave birth normally to a very live baby, and they were discharged the very next day. And the story we just kept thinking, okay, we would have done a cesarean section. We have a lot of risks that come with that, simply because someone read somewhere that a cord around the neck can put your baby's life at risk. So Google patients, we don't like you. No. But yes, so I would like you to help the people who are watching. What do you wish? And again, I think we have gone back and forth about it, but perhaps in a more systematic way. What do you wish people understood about relying on self-diagnosis and relying on the internet?
Firstly, I would want to say that anxiety is never a good thing. Though it has some part to play, I guess, but it has to be taken in proportion or in moderation, or should be balanced to a certain degree, and all decisions should be well informed. And Google is not a good or the best site to say I am well informed. In fact, even as scholars and medics, we are taught not to filter. We actually go through a process of filtering what you should read and from where you should read whatever you're going to do. Because most of that knowledge, I can even wake up, I've never done anything, but I publish. I just put it on Google, and someone reads it and all of a sudden it's changing their lives. But Google is not the best site, so it is not something you can rely on to say that I am making an informed decision on my health. Okay, that's number one. Coupled with the anxiety, which is the engine to drive everything, you want to do something to ensure that this disturbing situation is removed. But Google is not the best place to get an informed decision. That's number one. Two, fear that's coupled, of course, with anxiety. I think it's the Bible which teaches us that it is usually associated with some form of punishment. And it goes on to say that, but love drives out fear. So we can say that whenever you're fearing, it usually is leading to some form of punishment or expectation of punishment. And that already depresses you further, okay? And some of us who study the physiology behind, all of us who have studied the physiology behind, we know that the stress or the hormones released with stress, the cortisol and everything, they actually worsen your immune system. They do not instead strengthen it. You get it? So it really destabilizes you and can turn something small into, and you've seen all these different conditions like mass hysteria and what someone is okay, but they are actually manifesting the symptoms of someone who is sick. So it's that fear and that anxiety coupled with the Google, to be a Google patient Pro Max, it really puts you at a disadvantage and it underhands you. You get it, and puts you at a disadvantage that it only leads to something worse. You can never rarely will you read something from Google and you're like, hey, okay. And you really go deep into it, because our anxiety and curiosity leads you to read further on the worst things. How does it begin? Like, hey, it begins. How does maybe let me say like brucellosis begin? How it begins like this. I felt it, Yet it was not there because your system is actually learning the symptoms from. Like, hey, actually, I feel some fever. You read headache. Actually, I've been ignoring a certain headache, and it has been there, but I didn't know. So you start to convince yourself, and you are actually conforming yourself to that disease, which may not even be there. And the funny thing is, when they come to the doctor, so that it's okay, really, you are just tired. The symptoms disappear instantly. The headache is gone. Someone is okay, they are happy. You're like, hey, wow, okay, go and rest. How God told how Jesus told go and sin no more. So you told them, oh, go and rest. Then they go and rest. Dr. Msawa, I'm very okay. You get it. So, but also that especially I want to emphasize the point of being well informed. Get a second opinion from your doctor. Seek or consult. Get a consultancy and consult from a doctor and say, doctor, could this be this and this? Of course, the first thing we shall ask you is tell us more history. You get it? Tell us how did it come about. And we're actually trained to ensure that we filter out the unnecessary things. Of course, you can tell us, those stories. Hey, I was here, I was in Kampala, I went to Kamwenje, then after I came back, I had to change the fuel. But in there, I was feeling like, you get it? So, but first we can say, hey, no, this is an important thing, that is not important. So, we are literally trained to ensure that if you're looking for a well-informed decision in your life or for your health, we can give it to you. You get it? And also, apart from relying on the doctors, think on good things. Think on good things. Yes, you've seen and anxiety is trying to take you, but you also have the opportunity to bring yourself back. Try and control yourself and try and control your spirit. Read something nice. Read a nice. First, ignore it a bit, or ask the consultants. But first, undermine it just a bit, just enough that is enough to keep you in good spirits, because that's also very important for your recovery. It's part of our holistic learning and holistic medicine. So put in a good song, confess the right things, say, no, I cannot be sick, or if it's here, it's just temporary, it's to pass, Get yourself up in good spirits, even as you're even going through the whole thing. And that will even help, even if, God forbid, a worse diagnosis comes. That kind of spirit is the one which brings people out of hospital. You tell someone good news. We've seen it probably in movies, even in our health, we are taught that these elderly patients especially probably are bedridden. good news literally gets them out of bed. You know, when you tell them bad news, depression worsens, and and their bed sores start happening, and it's just going downhill. But if you tell them good news, so it's the same thing happens, that even as you're getting a second opinion, get some good news from the word. Get some good news, so get high spirits, tell someone, and control your atmosphere. Even if it's your child who is sick, speak to them and tell them, you'll be better. This is something small, it's going to go. That does not mean you be negligent. Have that balance. But for some of those things, they need that kind of composure and confidence of, to be better. So, 1, anxiety and fear are not your friend. You get it. 2, get an informed decision. And 3, lift up your spirits. Rely on the word.
Yes, thank you so much, Dr. Timothy. As you spoke, I remembered something that we used to talk about a lot in medical school. I think we used to call it the medical student syndrome.
Yes.
It's a coined term to mean how when you study something in class, because of how much you've learned about it, you start to feel the same symptoms in your body. So let's give an example of you study heart failure and how heart failure presents. And then you go back home and you're 23, you have a perfect heart structure, and then somehow you're not breathing. Somehow you start to climb up stairs and you feel like, I am tired. You're like, this is heart failure.
So this is now number 1.
Yeah, this is now. You even start to classify. So the information that you actually consume, your brain has a way of receiving it and it is able to manifest it.
Sure.
There are people who will come to you and they think, like you said, they think they have this particular disease. And as soon as you tell them you don't have it, they are very well. They are very well. And the other thing is, like Dr. Timothy said, we are taught history taking, which means to get whatever has been going on in your life and make a medical meaning out of it.
Sure.
So for us, you come and be like, hey, in 1980, they operated me here. Now I have come with pain here. And for the elderly, it's a very common thing.
You sit down.
Someone comes and tells you, yes, so I had an accident and they operated my head 20 years ago. Now I have headache. And for them, they think that two things are related. Have you been having headache over the last 20 years? No, it started yesterday. So me who has learned how to take history, has learned how to make sense of what you have to say, I will be able to iron out and say it is very unlikely that an accident you had 20 years ago is the reason you have headache today.
Sure.
Before we blame it, let's look for other things. But for you, because you had an accident 20 years ago and you have headache today, you will go to Google, accident and headache. Then guess what? It's going to tell you so much.
It will say, I'm surprised you're still alive. How are you cautious?
It will tell you you're bleeding in your brain.
You're literally bleeding now.
Yeah, and so when we tell you that going there, self-diagnosing, even us as medics, as a matter of fact, it is not advisable for us to treat ourselves.
True.
Because most of the times we will blow things out of proportion. Like I said, the medical student syndrome. Sometimes you see a patient presenting a certain way, and then you go back home because this person came like this, and this. Then when you check their blood, they had this. You go back home and you have the same symptoms. I work with a certain lady, and recently I've been telling her she needs God a certain way. So when someone comes, maybe they have gotten an accident, she will now spend a whole week saying, this person who had an accident, anyone could have an accident. She woke up and was okay, and the next thing she had an accident. I'm like,
but that's an accident.
Yeah, then someone comes with a stroke. I'm also hypertensive. Now what if I get a stroke? And then someone comes and they rob them and they cut them. She reinforces every lock in her house because they could. Like, young girl, you really need to find a place of rest. Otherwise, the hospital will kill you. You one day see someone who was okay and they died, and you will die. So
actually, on the part of the doctors, I think I had a funny story. We had a doctor and she tried to not she had like a son. I hope she doesn't attack me after here. So I hope she just tunes in now before my name. Maybe she will look for the face. But she had a son. I think they came to the private wing and everything. So I had gone to the private wing to do the rounds and what. So the son was managing. I think the son okay. Everything was okay. But she refused to reveal that she's actually a specialist. So for us, we treated, whether you're a specialist or not, the criteria is going to remain the same, the protocol is going to remain the same, we are going to continue treating. So we said, doctor, doesn't that child have a facial palsy? Because the child prefers smiling on one side, but otherwise the child was okay, eating is okay. When they're eating, you literally see all the muscles are working. But because, she's smiling, people have their different sides of smiling. So the doctor was like, isn't that facial palsy? So it's even worse for, when you have deeper knowledge, you say, this is facial palsy and this is the cranial nerve.
Something is
cranial
up
nerve
in the
7
brain.
is affected and everything. And it was kind of funny because it was the doctor and I told the child, okay, you smile for me and I see. Now smile wild. Then smile as big as you looked. I believe your issues are sorted. So I handed over.
Yes, and I think the other thing that was mind-opening to me was someone who comes and they're like, check very well. I could be having cancer. Do this scan. Check here. I feel pain here. Is there a mass? Look. And then the radiographer told them, no, right now I don't see anything. But we're worrying. Take it out if it's there. And
True.
that was an interesting question because, yes, you're so worried that you need to, and one might argue that if I know that it's there, then I'll get it early and then to be early diagnosis, maybe they can operate it, maybe not, you get. But sometimes you're really worried so much, and yet even if what you were worried about came to pass, your worry would not take it out.
Sure.
The Bible says that will worry increase the length of the hair on your head? No,
Sure.
it is not going to. And while we are pro early diagnosis, it's very important, but there are even some conditions which by the time you start to feel symptoms, you are way past the early diagnosis.
Sure.
So go get into the culture of doing general medical checkups, that's okay. But understand that your peace of mind is more important with any kind of illness. Your peace of mind is more important for your healing than anything.
Sure.
Actually, you will realize that when people are in hospital and they are sick and we come maybe to do the round, and then we notice this person has never smiled, this person is like very sad. Most of the time in our plan, we will have a counselor to come talk to you or maybe a psychiatrist to come and review, because we know that as long as you've lost hope, no matter what we do with our medicine, you're not going to recover. That's why for most of the time when someone maybe has HIV or maybe they have cancer, the news is broken to them with a team.
Sure.
You will get a hospital counselor and then you tell, okay, you have cancer, however, there are people who have lived. This is not the end of the world. Why are we telling you all that? Is it because we don't have drugs? If drugs were all that were required, why don't we tell you, you have cancer, take this drug? Why do we add more to just breaking the news to you? Because we know that we need you to be positive. We need you to see life beyond this diagnosis. And if Google has already done the greater part of taking that away from you, we will not perform a miracle. We will not perform a miracle. So, and like Dr. Timothy said, please reach out. I am sure if you check out in your contact list, you will find at least one doctor. And okay, if you have none, you leave your number at the comment section. Sure. I am now here. I can help you. You can say, I have been feeling headache. Google says I have a brain tumor. I'll help you. Or Dr. Timothy will help you. But please don't take yourself through that. It is not nice. It is. We see people, and even let's even stop talking about your health. The doctor that you're seeing is just not enjoying their work.
Very true.
You're
Very
just
true.
making them have a very bad day because they are trying to tell you what they know. It's like sometimes I relate it to our parents. How they would tell you, don't put on a short skirt. And then you're like, it's the one I want.
Mm.
And then they want to tell you that, you see, with this short skirt, this and like they have seen 10 years ahead. And they
The burden of wisdom.
yes,
Mm.
with more knowledge comes more sorrow. They have seen 10 years ahead. They are seeing what you're putting yourself through by you starting to dress indecently at this age.
Mm.
But unfortunately, they really can't tell you. They can't break down everything. And
Sure.
perhaps they have been where you were, and they know they did that, and maybe some of them made mistakes, but they can't really tell you. So that's the same thing. Sometimes we want to tell you that you're killing yourself. We want to tell you that you're not the first. And some of them come like, you've never seen one like me. I am the first. Someone comes and tells you, I have this, I have this. Recently, I had a woman. She came with some abdominal pains and she tells me I have malaria. The good thing with this one, she was not a Google patient.
Mm.
So she's like, I have malaria. Then I'm like, okay, we can check for malaria. However, we can look elsewhere. These symptoms can also be caused by this and this and this.
Mm.
Doctor, I have had malaria before. I am a 50-year-old. I know how malaria feels like. And I said, I really agree that everything you're feeling can be caused by malaria. Really, truthfully speaking, in my head, I didn't think she had malaria because there are some clear things that she didn't have. But now I tried to really get there. I understand that it could be. However, it could also be this.
Could also be.
So is it okay if we check for these two?
Mm. Could
And
be
then-
incidental finding.
Yes.
Mm.
So she's like, okay, let's check. But I know it's malaria. The good thing she had her son, and you know, as you're like, check everything when it's your parent. Whatever you think about doctor, you check. And then somehow, when the results came back, she had what I thought she had. Then she looks at me like, okay. I can assure you, I thought it was malaria.
Sure.
But then at that point, I was like dropping my mic of Saudia, or I
Yeah.
don't do that alone. Sometimes it's that thing of, I am glad you listened. Because if she hadn't, I was going to tell her, oh, you don't have malaria. And then she goes and then she's not feeling okay. So we are professionals and we are not the best. And maybe I must add that not everyone you go to and is in a room that looks like a consultation room is a doctor. And perhaps not every doctor you meet is a very good doctor. So instead of going to rely on Google, if you feel like you're not satisfied with the one who has seen you, seek a second opinion.
Sure.
Then there are also those who are really doctor hopping.
Mm.
That would be another conversation
Another
for
one, because
another
we have
day.
that one.
Yeah.
You find that they have, no, this doctor told me this one told me this. But for me, I know.
Yeah, me, I know it's
they
this.
first, they first gaslight you. Me, I know. You are the one who knows my actual issue, and
Yes.
so they come. But when you tell them,
You're not, especially when and sometimes you find Dr. A told them the truth, Dr. B told them the truth, Dr. C told them the truth, but they are looking for the one who will tell them what they want to hear.
and they want the injection. They don't want.
Uh-huh.
They want the serious. I want a bed. They come. I want a bed. Nothing
Yeah.
else. You don't. This one, if you go have some amoxicillin or something, you swallow, you'll be fine. 5 days, you go. They even come and say, doctor, this is what the other doctor gave me. But for me, I want.
Yeah, you reminded me of the old woman who came and I was telling her, okay, we're going to give you this, it's going to help what? Then the daughter called me and said, if you don't give an injection, she will not get
True. I don't know what's it. What do they like? I don't know.
No. Do you know what I did?
Mm.
We agreed, they had a nurse in the home. I prescribed for her Panadol. So the Panadol was given IV because the other way we were going to give it.
I get. We have our kids around.
So I told her, okay, we are even going to give you injections. Your disease is okay. Now, and guess what? She got better. Yet the drugs I had given her were all the same as what everyone had given her, but Panadol that was
I think we shall even talk about our malingering patients. Those are so fake. Doctor, I'm feeling a pain here. But they just want the attention.
Not just the attention. There is one who came with, I am dying. And I told, now, I think you'll be fine. Doctor, I don't think I can go to work tomorrow.
Right for me, right?
Right for me, I leave. I'm like, you
Very
could have
true.
had this conversation as an adult, even
Mm.
though I will not do it for you. Sorry. But someone comes and anyway, we are probably straying off, but there are things that you will come claiming to feel that medically don't make sense. So there is a young girl who came, I can't breathe. But when you're having a conversation with her, she talks
Those are the ones.
non-stop. Then when the conversation ends,
She
then
goes far.
the
They want
breathing.
that kind of, attention.
Yes, and then I'm like, medically speaking, don't complicate my life. Anyway, we'll have lots of conversations like that.
Sure.
But now, again, you had really talked a lot about this, but in conclusion, should people stop being Google patients, or should people stop looking out for their, not maybe looking, surfing about their symptoms? And what does healthy curiosity look like? I think you had really hinted on it a lot,
Yeah.
but just maybe in your parting shots.
Okay. I think I can just recap that. One, fear and anxiety aren't your friends. Though I understand that they are there to help you, to be curious. And two, get a good, when you're feeling anxious, having fear about a certain symptom you have seen, get a good sermon, watch a good message, listen to a nice song, get it, speak positively, confess the right things, and then well-informed decisions. Make well-informed decisions that contact a doctor, seek a second opinion, third opinion if you feel it's not okay, and go for consultation. Go to the clinic duties and see someone about something, and we see how to make it better. But I wanted to add, especially in the parting shot, that the biggest, firstly, medicine is different in different nations and in different areas. You get it? And even the populations respond differently. So you'll find that maybe you're worrying about something that is not even in the same region that you are at. You get it? And we're actually surprised that if we find it, we shall have to report it to the ministry. And
they will make news like
yes,
this.
you get it. So medicine is different and it's very complex. We've taken years, some have spent in 20 years, perfecting their craft. We've had knowledge that has been coming from, as all I don't know, as, pre-technology and all that. And we've been trying to keep records, trying to understand your body better. So you should know that the fear won't help you. This is a very complex thing, and doctors are really doing their best to ensure that that fear becomes baseless when we give you our opinion. That we take away that fear, we treat you. But also we have a very important one that has come from since before, which is the word. You get it? If you're a believer, get the word, get your spirits up, but also believe. Get those texts, read them, see how to apply them, keep your faith up, keep your hope up. It doesn't hurt. There are some people, when you talk about faith and health, they want to fight you. You get it? But it doesn't hurt. The Bible says, you test and see, try it and see. Believe the good thing, don't believe the bad thing. Fear is trying to cause you to believe the bad thing. Believe the good thing. Say, no, but I'll be better. We've had miraculous patients. You get it? We've had, the doctor doesn't know what happened. Those things are there. It could be you. You get it? It could be you. So, to go back to your point that is the Google patient, is it good to be the Google patient? No, it is not. It's not good to be the Google patient. However, have a good health-seeking behavior. If you know that something is persistent, as you're developing your faith, seek that opinion, get that help, try to live a comfortable life. Okay? And you'll find that things will get better over time. Yes.
Yes, thank you so much. As you spoke, I think you've said literally everything, but I just wanted to let you know that we are really here to help you, and that's the best that we can do. Actually, on Google, you'll find for us as medics, there are times when you read a paper that has been published through the right channels, medical journals, and then, but that paper was published last year. Now there is a new paper.
Now there's a new one.
And when you are discussing amongst yourselves, so this, according to this paper, they're like, what do you mean that we no longer use that information?
Sure, it's
now
changing everything.
it has changed. So for you, you do not know that not everything you read in a medical journal is still relevant. Like you said, someone will come because Google told them you probably have smallpox. Smallpox that was eliminated.
The chapter. But you've opened.
But you've opened it. And because Google will give you any information that has been deposited on it. So if for us, even in our reading on the internet, we have to keep our knowledge updated every other time. Recently, I was talking to a diabetic patient who was telling me, but I was told I have to stop eating this and this and this and this and this. And I'm like, okay, now newer information shows that, there is a way we can deal around food. But someone will Google, then people come, their mother was told they have hypertension, they Googled and told them, stop taking salt. And you're like, who told you to stop your mother from eating salt? I read it somewhere. Now this one comes with now worse complications of no salt. Why? Because you Googled. So what can I say? We would have a whole day talking about this. But the gist of the matter is, trust your doctors. At least trust someone. You live in a world where you must learn to trust another person because you can't be self-reliant. So seek medical care. If you don't agree with one, go to another. And make sure, please, I must emphasize, make sure the one you're seeking care from is a qualified person. This we will probably talk about another day, because some of you are there having been told things by people you thought were medics simply because they were male and in a court. And now you are suffering from whatever they thought you had. But we will probably discuss that eventually. And like he said, very importantly, I told you from the word go that I am a Christian. And maybe you don't agree with Christianity, or maybe you do. But there is something that one of my professors once talked about in our lecture room. We were arguing about people who say that they prayed for someone and HIV got healed. And then they were like, that students were asking him, and that those conversations, usually in those conversations I would keep quiet because I didn't want to be involved. And one of the things the professor said is, you see, when HIV, no one can pray for HIV and it gets healed. That's his opinion. But when they pray for this, when these people start getting into prayers and everything, they start to have hope, they start to live happy lives, they start to eat well, and because they do that, they take their drugs well because they now have a better vision of life, and then they become suppressed. Now, suppressed means like they can't detect the virus in your body. The viral load is very low. And so when people are very, very suppressed and you do some tests, they might be negative. Now, that is the way science can explain it, and I am not going to debate this. But what I'm really trying to say is, if someone, by going to pray, can start to live well to the point that they get suppressed, then how about you who has malaria? So find something that gives you hope. Find something that gives you hope. Find God. Find purpose. Yes, and as usual, we cannot close without doing this, to give you an opportunity to receive Jesus Christ. For us, we received him, and if you're there and you feel like, the hope that I've been looking for is in you, Jesus, please repeat this prayer after me. Say, Lord Jesus, I thank you for my life, and today I receive you in my life as my Lord and my Savior. I am born again. Amen. If you've made that prayer, you are born again. And we love you. Find time and go to church and pray. And you're a child of God, you're different. Thank you very much. Otherwise, I remain Dr. Masike Mugela, Heartbeats and Hope. Till next time. And as usual, shout outs to Creative Media and Podcasts for hosting us. And if you're there and you would want to do a podcast of your own or anything that requires a space like this, please reach out. We love you.